confirmed number of coronavirus cases in Los Angeles County comes to 1,229,641. The confirmed number of deaths reaches 23,668. Here in Torrance, the total number of confirmed cases is 7,191, with total confirmed deaths at 206. We anticipate those numbers to increase as the county updates its last 24-hour operating period. Welcome to COVID-19 Today. I'm Leslie Robbins. It's 4 p.m. on Wednesday, April 21st. Los Angeles County continues to make great progress in seeing a steady decline in daily coronavirus case counts and daily deaths. In the new state-released updated numbers, LA County's adjusted case rate dropped from 3.2 new cases per 100,000 people to 2.7 new cases. The test positivity rate also dropped from 1.5% to 1.2%. While Los Angeles continues to remain in the orange tier, each week the numbers continue to decline, bringing the county closer to moving into the least restrictive yellow tier in the state's blueprint for a safer economy framework. In order for that to happen, the county's case rate must be less than 2 new cases per 100,000, with test positivity less than 2%. Health officials urge those who are eligible to get the COVID-19 vaccine to register online. The county's public health department announced that this week, everyone living or working in LA County 16 and older can receive the vaccine at the new Palmdale and Lancaster vaccination sites without an appointment, as registration can be completed on site. Vaccination sites accepting walk-ups are located at Palmdale Oasis Recreation Center and the Palmdale and Lancaster MetroLink stations. You can also go to vaccinatelacounty.com to make an appointment closest to you. The U.S. Food and Drug Administration revealed some unsettling news about the conditions of the vaccine plant where the single-dose Johnson & Johnson vaccine was being made. The FDA cited the Baltimore facility run by Emergent BioSolutions. They cited unsanitary conditions. Officials say the facility had peeling paint and brown residue on the floors and walls. Inadequate cleaning and proper manufacturing procedures were not being followed, and staff were cited as not following procedures to prevent contamination. The FDA released a 13-page report detailing the findings from its recent inspection of the factory. Inspectors said a batch of the bulk drug substance for J&J was contaminated with material used to make COVID-19 vaccines for another client, AstraZeneca. As a result, a batch of about 15 million doses of the J&J vaccine had to be thrown out. Both Emergent and Johnson & Johnson said in a statement that they are working to fix the problem as quickly as possible. Nothing made at the factory for J&J has been distributed, and at the moment, the single-dose vaccine is on hold in the U.S. as government officials investigate its connection to rare blood clots. The nearly 8 million doses of the J&J vaccine that had been used in the U.S. came from European sources. Well, a new study reveals that women who take nutritional supplements may be less susceptible to contracting COVID-19. A research team from the UK, Sweden, and the US looked at data from 445,000 people and found that women who regularly took vitamin D, probiotics, and omega-3 fatty acids had a lower chance of testing positive for an infection. While the same effect was not observed among men, researchers say the reason may be that women have an overall better approach to health care compared to men, which allows them to lessen their chances of getting sick in the first place. In the American group, vitamin D had the greatest effect, followed by omega-3s, probiotics, and multivitamins. Health experts say as supplements can get costly, people can easily change up their intake of food and lifestyle by eating a wider and healthier variety of foods and going outdoors whenever possible. As coronavirus cases continue to decline, the U.S. State Department is urging Americans to reconsider any international travel. Now, while it's not a formal global advisory, the State Department announced it will boost its do not travel guidance to about 80 countries across the world, citing unprecedented risk to travelers. They'll start using the U.S. Centers for Disease Control and Prevention standards as it prepares health and safety guidance for individual countries. Close to 80% of countries will be classified as a level 4 or do not travel, of which 34 out of nearly 200 countries are already listed, including places like Brazil, Argentina, Russia, Kosovo, and Haiti. This means close to 130 countries are getting added to this list. Travel is also discouraged for the remaining 20%, though not as strongly. The CDC says the COVID-19 pandemic continues to pose unprecedented risks to travelers. In light of those risks, the Department of State strongly recommends U.S. citizens reconsider traveling abroad, especially for unvaccinated individuals. A federal judge overseeing a lawsuit on homelessness in Los Angeles issued a ground-shaking ruling Tuesday, ordering the city of LA and the county to find shelter for all unhoused residents of Skid Row within the next 6 months. Judge David Carter's filings were made a day after Los Angeles Mayor Eric Garcetti vowed to spend nearly $1 billion in the coming year to combat homelessness. The judge ordered that all women and children on Skid Row receive interim housing in the next 90 days, and every homeless person in the downtown area must have a place to stay by mid-October. Garcetti raised doubt about the judge's timeline, saying that would be an unprecedented pace, not just for Los Angeles, but any city that faces homelessness in America. Skid Row encompasses close to 50 blocks of downtown streets, which contains one of the largest populations of indigent people in the country. It also accounts for about 28% of the more than 60,000 homeless who live in LA County. According to the motion, once shelter is offered, the city of LA would clear the sidewalks, and anti-camping laws would then be enforced to keep the area free of encampment. The lawsuit was filed last year by a group of business owners, residents, and community leaders called the LA Alliance for Human Rights. If a road trip to Yosemite National Park is in the plans for your summer vacation, Californians will now be able to reserve your day passes starting today. Reservation passes will be needed for all visitors starting Friday, May 21st, and already the first few days have sold out. Earlier this month, park rangers announced they would require day use passes to enter the park as a way to help them manage the number of people visiting during the pandemic. Each reservation is good for 3 days and will get one vehicle and its occupants into the park. Annual and lifetime pass holders are also required to get a reservation before going. The reservation system is set to stay in effect through the end of the summer. Go to recreation.gov. The city of Torrance made a big announcement today in naming new leadership for the police department. Out of 17 candidates who applied for the Torrance police chief position, Torrance City Manager Aram Chaparian was thrilled to share the news that Jeremiah Hart, who has served most recently as a Torrance Police Department lieutenant, was appointed and will serve as the city's 11th police chief. Hart began his law enforcement career as a patrol officer with the city of Pasadena. 3 years later, he was hired by the city of Torrance and has served in various assignments, including patrol officer, recruitment training officer, and patrol field supervisor. He was then promoted to sergeant and served as assistant to the chief and public information officer. Most recently, Hart was promoted to lieutenant, serving as watch commander, supervising the traffic and special events division and managing the communications and information technology division. He also acted as the unmanned aircraft systems commander and as a member of the Special Weapons and Tactics, or SWAT team. Chief Manager Chaparian said, quote, Jay's experience, continued education, training, and community involvement are reflective of his professional commitment to law enforcement and to the city of Torrance. He remains actively engaged in the law enforcement community and is focused on providing the highest standards and optimum public service. Torrance Mayor Patrick Fury also shared this statement, quote, Hart's excellent interpersonal skills, which enhance his ability to provide solid, reliable leadership to the department, will be significant, and it's an asset to the community. A formal pinning will be scheduled once Hart begins his post on June 20th. The community is invited to participate in the upcoming City of Torrance Planning Commission workshop taking place just 1 week from today. On April 28th, the public can join virtually to learn more about the Housing Element Update. The Planning Commission will conduct a public workshop and is hoping to get your input regarding the 6th Regional Housing Needs Assessment. You'll see on the screen how you can join the meeting next week. For more information, you can call the Community Development Department at 310-618-5990. Torrance City Council members headed back into the chambers last night in a hybrid council meeting. Items on the agenda included several proclamations, including declaring April 22nd as Earth Day here in the city of Torrance. The Madrona Marsh Nature Center will host a number of activities in celebration and encourages the public to participate. The city also declared the month of April as National Child Abuse Prevention Month, encouraging families to seek resources and support from the many organizations and resources available to Torrance residents. The city also recognized 28 new recipients of the city's 2021 Hometown Heroes banner program, as the banners continue to be installed and will remain displayed over the next few months. The city manager also shared the latest COVID-19 response and recovery efforts in the city, including the ability to meet in person once again after meeting online for more than a year. Then the Finance Department presented the city's second budget overview session, a continuation of last week's presentation in a three-part series. The budget included a two-year 2021 to 2023 operating budget, as well as a five-year 2021 to 2026 capital improvement budget. Department directors from police, transit, and public works shared staffing and financial information, along with goals and priorities within each department. Then council members voted on a much talked about topic to approve going to bid for a noise monitoring system at the Torrance Airport. Last year, the City Council did not replace the outdated system, which was installed in 2008, in the hopes of saving city funds. But after recent Airport Commission meetings where the panel made recommendations to the council to install an updated system, a majority supported the idea. According to the staff report, several homeowners groups also showed support for a new system. The council voted unanimously to issue a request for proposal for an airport noise monitoring system. The mayor and council members agreed having a monitoring system back in place will get everyone to comply with the rules and regulations set in place at the Torrance Airport in order for residents and pilots to coexist safely. You can catch replays of the full meeting on our channel, on our website, as well as on YouTube and social media sites. On today's Wellness Wednesday, Christine Lee visits with the medical director of the emergency department at Providence Little Company of Mary to find out why people should not put off going to see their doctors for routine checkups and screenings despite the pandemic. Let's take a look.
As COVID numbers go down and vaccine productions ramp up, we're checking in with one of our local hospitals to see how they're doing. Joining me right now is Dr. George Vernis with the Providence Little Company of Mary Medical Center here in Torrance. Thanks so much for joining me today.
Thanks for having me.
So how has the past year been? Can you walk me through your personal journey?
Sure. So it's been a kind of a roller coaster over the last year. I think the pandemic started about a year ago now. We were all very fearful coming to work back then. We didn't know what was going to happen with the virus, if we were going to get exposed, if we had enough PPE, if our PPE would work. So it was very fearful back then. Luckily, our spring kind of surge was not as bad as we expected. One kind of consequence of all the stay-at-home orders is actually our volume of ER patients back in April and May dropped by 70%. So we really had a precipitous drop in the patients just coming for routine care, and I think really in fear of getting COVID or catching COVID or being around COVID patients. So that was kind of the initial first surge kind of experience. We got through that. Once the first surge was over, the summer kind of turned back to normal. COVID was always there, but patients started coming back to the emergency room. But one thing we did notice is during that April-May time, people delayed real serious symptoms. They had chest pain, they had heart attacks and strokes, and never presented to the hospital and had worse outcomes. So that was a concern early on. After getting through the fall, and then this latest surge was much, much worse. Kind of in the spring, our max COVID patients in the hospital was 80. We were down to the 10s and 20s in this fall, and our peak in January was 180 patients in the hospital at one time. So this last surge was much, much worse in the spring, and it was very challenging to all of us. One nice thing is that most of the caregivers had already started to get their vaccine, so that fear of catching COVID from your patients was much less. Yeah. So luckily that second surge is over, and we're in a much better place now. So it's been a tough year.
At the peak, how many hours do you think you were logging per shift?
So, you know, in the ER, we have dedicated shift times, and so we come and go on those times. We didn't really need to have extra hours. In fact, again, like in the spring, our overall patient volume in the ER has been less than traditional, so we have plenty of physician coverage for the patients that we had.
Well, you and those at the hospital, I mean, you're experiencing such a unique journey together. How were you able to support each other during that time?
There's a collective need. I think we're all comrades. We're all here to work together for the community and our patients. And so the physicians and the nurses and nurse practitioners, we all work together as a team to help the patients in the ER and the hospital. I mean, we work closely with our hospitalist doctors and ICU doctors, and we're here to treat our patients. I would say, our administration has been very supportive of us. And one thing I noticed at our hospital compared to ones I've seen in the news is that even when we are at our peak, our ICU was full. Many hospitals then turned their ERs into extra ICUs and really limited access to the community. Here at Little Company, our administration did an amazing job of expanding our ICUs, having those 180 patients in different parts of the hospital. It allowed our ER to function really well even during the worst times of the last surge.
Well, that's great to hear. And as COVID numbers start to go down a lot now, are you thinking about unwinding?
I would say yes. We're still holding our breath. I think the most unwinding I've done so far is just to go about the restaurants that I like to go to that are now open. We can at least sit outside. So I think that's about it for me.
Mm-hmm. And for me, as a non-COVID patient, the thought of going back to a hospital type setting honestly worried me. I'm thinking that there are people with COVID that could have walked down the exact same hallways. Now, is this a common fear a lot of patients have? And what can you say about the safety of the hospitals now?
I would say it's a very common fear. I mean, as I talked about the numbers in the spring, and even now we're still down from our ER patients, that it is a fear. It's a very rational fear, but what we've learned over the last year is to do the best practices of infection control. We test every patient that comes in the hospital for COVID. They go on dedicated units. So there really is little to no chance of being exposed to COVID coming to the hospital or a medical setting at this time.
Yeah. And why is it so important for people to stay on top of their health right now, be proactive and not delay care or screenings?
Like I mentioned in the spring, we had a lot of bad outcomes. People delaying care, not coming to the hospital for their chest pain or stroke-like symptoms, and then they had worse outcomes, or delaying their abdominal pain, and now their pen is now burst and they're having a worse outcome. So all those reasons, don't wait. If you have any symptoms that you're concerned, our emergency department's open. We have plenty of capability to see you. Infection controls are all in place. All our caregivers pretty much have been vaccinated. So there's no fear. You should take care of your health, and we are here to take care of you.
Thank you so much, Dr. Vernes, for sharing your thoughts with us today.
Thanks for having me.
And as he said, hospitals are doing all they can to keep you as safe as possible. So don't delay and make that appointment today.
Thanks so much, Christine. Great information and reminders that we shouldn't neglect our health. Well, before we go, at the end of each program, we like to share feel-good stories from our community, pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. Well, as Earth Day approaches, one local business is hoping a little sweet incentive will encourage people to help take care of our Earth. Torrance Bakery is offering a free cookie to anyone who picks up trash on Earth Day, which is tomorrow. All you have to do is pick up trash that day and let the bakery staff know when you get there, and then you can choose between a chocolate chip, oatmeal, or a peanut butter cookie. Don't forget, you can also pick up a free cookie when you show the bakery staff your COVID-19 vaccination card. Sounds like a win-win. Torrance Bakery cookies are probably one of the most popular in town. What a great way to show how to care for one another and for Mother Nature. Now, if you have a great story, upcoming event, a photo or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. We'll see you back here tomorrow as we introduce you to the latest member of our City Cable team. Please be safe, stay healthy, and thanks for tuning in. We'll see you next time.